Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. So this past April, England published the Cass Review, dubbed, and I quote, the most comprehensive summary on transgender youth medicine, end quote. The review, chaired by Dr. Hilary Cass, former president of the Royal College of Pediatrics and Child Health, stated that there is insufficient evidence to demonstrate the long-term benefits of medicalizing children who want to identify as a different gender. Instead, the review recommends focusing on psychotherapy. The National Health Service of England, which commissioned the report in 2020, stated that it would be committed to following through on the recommendations. Quote, the Cass Review final report will not just shape the future of healthcare in this country for children and young people experiencing gender distress, but will be of major international importance and significance, end quote. 8 days after the Cass Review's release, Scotland's health boards announced a pause on new prescriptions for puberty blockers and cross-sex hormones as they gather evidence to support the safety and clinical effectiveness of these medications. Seems like a reasonable thing to do. The Cass Review is based on the work of 237 papers, including 214 studies, 21 guidelines, 2 position statements, which covered data of more than 113,000 children and young people. The authors also analyzed data from more than 3,700 children diagnosed with gender dysphoria, survey responses from professionals, and numerous interviews and testimonies from stakeholders. The review team commissioned researchers at the University of York to conduct systematic reviews of these papers and get feedback by interviewing young gender incongruent children, their parents, and clinicians. The review found insufficient and inconclusive evidence demonstrating the effectiveness and benefits of gender reassignment treatments for children. Additionally, many of these children are on the autism spectrum and share mental comorbidities, often overshadowed by the medicalization model. Dr. Cass hence advised cautionary psychological interventions while also leaving room for children to explore their identities. The Society for Evidence-Based Gender Medicine, SEGM, a medical group that advocates for evidence-driven research on transgender care, stated that for England, the review marked, quote, the end of the era of a highly medicalized approach to the treatment of young people with gender-related distress, end quote, which has come to be known as gender-affirming care. The report also mentioned that while medicalization comprising puberty blockers, cross-sex hormones, and surgery, known as the Dutch Protocol, was invented in the Netherlands in the 1990s, the concept of gender affirmation, accepting children's gender identity at face value, actually originated, you guessed it, right here in the US, and then spread internationally. As a result of the review, children under 18 in England will not be treated using such protocols, but with the same level of care as other youths and with mental struggles. Finland and Sweden have made similar changes in 2023. You know, Dr. Cass really needs to be applauded for this because she has gone against the popular culture and actually trying to find some evidence for these interventions that we've been making. So it's pretty self-evident if you have gender dysphoria, if you're really trying to help these young people, it makes more sense to find out why they feel this way and help them cope with the reality rather than trying to change reality to help them live a fantasy that will never be attainable. Make no mistake about this. There's no amount of drugs or surgery or social acceptance that will change your chromosomes. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.